people of Mississippi for the work that they are doing. To the extent that we are slowing the spread of this virus, it is because of the efforts of people throughout Mississippi. And I want to thank you very, very much for what you are doing. We are working together to combat COVID-19. We are working together to safely, responsibly reopen our economy. And I want to say a personal thank you to everyone in this state who is working with us to make that a priority. Today I want to speak a little bit about the actions that we are taking to distribute the CARES Act funds that have been delegated to governors to respond to this crisis. We know that one of the most important things we can do when dealing with large amounts of federal money is provide for compliance oversight. The Congress gave governors a lot of flexibility on how to distribute these funds, but there are still rules. Rules we have to follow or we'll risk losing it all. I had the opportunity to serve as state treasurer during Hurricane Katrina in August of 2005. Immediately after that hurricane, I was asked by the United States Senate Finance Committee to come and testify before them regarding potential legislation that turned out to be the Gulf Opportunity Zone Act of 2006. It was an act which enabled Mississippi to receive a significant number of funds. It also was an act that aided our recovery significantly. In addition to that, I also served during the American Recovery and Reinvestment Act of 2009, which was the movement made by the Congress in the aftermath of the significant downturn in our nation's economy. Today, I want to announce that we're starting a competitive bidding process for third-party oversight of the CARES Act funds as we begin working to get those out to the people affected by this pandemic. That means that there will be a third-party team with lots of experience making sure that the state never goes outside the lines and uses this money in an improper way. I saw that done in the state of Mississippi in the immediate aftermath of Hurricane Katrina under Governor Barbour's leadership, and then again later in his term. And I believe that the lessons learned are critical. They are important. We have to be transparent. We have to be careful. We have to make sure the money gets in the right hands because there are always some people who want to take advantage of a crisis. I've been talking with our friends in the legislature and other state leaders. We had a call with supervisors today. We had a call with mayors on Friday. We had a very productive call with leaders of the Legislative Black Caucus yesterday. I believe that all of our state's leaders, local, county, legislative, statewide, and otherwise, are committed to our mission, and I'm grateful for their critical partnership. We all have a role to play. As governor, it's my job to make sure that this federal emergency money gets in the right hands. Mississippi's past practices have proven that strict compliance checks are the best way to make sure that happens. We should have that settled by early next week, and then we can begin the process of utilizing these funds. As always, I want to be transparent about our thought process. There's been a lot of federal funds entrusted to governors across the country, and I want you to know our plans to make sure they help the Mississippians who need it the most. Here's what that looks like. We know that this virus could come back, and distance learning may become a more typical part of our education system. We also know that there are families without access to the tools that are necessary for distance learning. Not every kid has an iPad or a laptop to learn with. Too many families are sharing one outdated computer or maybe don't have one at all. They may not have internet access to connect to class. I plan to utilize CARES Act funds to help fix that, and it will be a top priority. Support for teachers, schools, and especially parents will be a critical part of our recovery. We know that some small businesses have been hit harder than others. Grocery stores are doing okay. Barbers, salons, small restaurant owners, and more are watching their life's work go up in smoke because of unprecedented government rules. They never could have predicted that their business would face this pandemic. There is some federal help for small businesses, but I hope to use some of these funds to help them stay on their feet, keep their workers on their rolls, and weather this storm. We know local governments have incurred expenses that they never budgeted for during this time. We've been doing regular and constant conference calls with mayors and supervisors. In fact, just had a call today with the supervisors. We had a good conversation about what we can and what we cannot use these monies for. I hope to use these funds to help them deal with this critical issue. We are partners, and we will get through this working together. We know that there are tens of thousands of Mississippians who have lost their jobs as a result of COVID-19. We hope they will be able to get right back to work in their previous place of employment, but we know that won't be the case for every single Mississippian. If you find yourself in a position of extended unemployment as a result of this virus, we want you to return to the workforce. We also want you to earn even more money than you earned before. If we can get your pay up in the face of this pandemic, we want to do so. I plan to work to provide CARES Act funds for skills training for workers who have been displaced by the virus. I said it when I took office, and it's even more necessary now. We need to get average pay for Mississippians up. It has to be higher, and it must be one of our primary priorities. I want every Mississippian to earn more money. I want to help those workers who have carried the financial burden of the coronavirus response. The best way to do that is to help you get more tools to earn a higher wage. I believe we can do that, and I plan to utilize our CARES Act funds to do so. Also, we have a system in Mississippi where small businesses provide the money for Mississippians on unemployment assistance. Right now, those small businesses are barely able to stay afloat, much less pay for the historic spike in unemployment. They didn't decide to lay these workers off. The government shut them down. I plan to take the burden off of them and use CARES Act funds to help pay for the unbudgeted expenses in our unemployment system. There's much more that we can do. We need to take care of our hospitals. We need to take care of our healthcare workers, our first responders, our local leaders, and more. I just wanted to provide an early window into how we plan to use the funds that the Congress and the Trump administration have secured for states to address this crisis. I want to thank them for giving governors the flexibility to do what is best for their states, and I know that this can do some real good for Mississippi families. It can mean iPads for kids that can't afford them. It can mean higher pay for Mississippi workers. It can mean help for our cities and our counties. It can mean relief for our small businesses. We will be able to help our state reopen. We will be able to help our state rebound, and we will be able to help make our state come back even stronger. I've invited our 2 Mississippi senators to join our briefing tomorrow to provide their perspective on the CARES Act and the federal response to COVID-19. I'll be honored to have them here with us tomorrow. They've done a tremendous job representing Mississippi in Washington, D.C. They've done a tremendous job working with the President and the Vice President in the Coronavirus Task Force, and we as Mississippians are lucky to have them in their positions of leadership during this time of crisis for our nation. We are going to come through this working together, and I want to thank every single one of you of the sacrifices that you are making. Working together, we will come out of this bigger and better and stronger than ever before. At this time, I'm going to ask Dr. Dobbs to give us an update on our current COVID-19 tracking. Dr. Dobbs?
Yes. Thank you, Governor. As we look into new cases for today, we had a significant increase in our reports, reporting 248 new cases with, unfortunately, 10 additional deaths. We still have a significant predominance in our African American community, as well known. If we look at some other trends that are somewhat concerning, we are seeing an increased utilization of hospital capacity of patients with coronavirus. If we look at the number of hospital beds being occupied, we're at an all-time high of 429. And if we look at the number of ICU beds, we're not at a high, but we're at a level that we haven't seen in about a week of 162 ICU beds occupied and 77 COVID patients on respiratory support or ventilators. What does that mean? It's hard to know for sure. It could well be that our peak has passed and we're seeing more cases. That's a plausible scenario, but it's also plausible that we're going to have continuing increasing cases and increasing hospital utilization. This thing is not over. We need to continue to be careful. Certainly, we have flattened the curve, and we feel like we've maintained a pretty good hospital capacity to make sure that everybody in Mississippi can get the care they need. But please, now's not the time to let down our guard. We have the governor, under his leadership, we've made things more available for day-to-day life that needs to happen. But please, every person, exercise as much caution as you can when you're out in public. Use your masks, don't go out if you don't have to, and make sure you maintain that social distancing. There is increasing availability of certain forms of medical care, but I would like to stress that if it's something that can easily be delayed, if it's not an issue that requires medical attention, if it's a procedure that can be delayed, especially if you're older, if you have chronic medical conditions, there is still coronavirus transmission in the community. There is some mild increasing stress on the healthcare system. So please, from an individual basis, if you have a medical issue that is not urgently needing attention, please delay it if possible. If you do have an urgent medical condition, please seek care from your physician or provider. That's all I have, Governor. Thank you very much.
Thank you, Dr. Dobbs. Again, I want to reiterate to the people of this great state that we are not out of the woods yet. There is more work to be done. We as individuals have to be responsible. We have to, if we leave the house and go to the grocery store or to even a necessary medical procedure, wear a mask, protect yourselves, and protect those that you'll be around.